stage. Over to you, sir.
Okay, thank you, Sushmita. Let me share the slide.
Sir, can you a little bit
Is it okay
increase
now,
the
Sushmita?
volume? Sir, little bit louder, please.
Okay, is it okay now?
Yes, yes, sir. Yes, sir. Now it
Okay,
is
okay.
okay.
Let me share my screen first.
Yes.
Okay, I think it is visible to everyone.
Yes, sir. It is visible. Yes.
Let me make it full screen. Okay, is it visible in full screen mode?
Yes, yes, sir. Yes, sir. It is
Okay.
visible.
Okay. Thank you, Sushmita, for my introduction.
Yes. Sir, I
And
think your voice is
as
coming very
before
low.
that, I will.
Uh,
Is it okay now? Not?
uh, no, sir.
Now it is okay.
Yes, sir. Now it is okay.
It is okay now for everyone. I
Everyone,
think.
it is okay. The participants, can you hear?
Yeah. Is it okay? You can write in chat box also.
Yes, sir.
Otherwise,
Yes, sir. Yes,
I
sir.
have to arrange something else.
Yes, sir. They are responding. Yes. You
Okay.
can
Okay.
continue, sir. Yes.
Yeah. Okay. So I will be discussing on the basic concept of animal handling and ethics in experimental pharmacology. So as because it is a e-workshop, so I thought that I have given my best to give number of schematic representation with figures and number of videos is given. So make the student understand the basics of animal handling as well as what are the ethics in experimental pharmacology that is applicable to us. But before I start to my content, I want to thank and congratulate the organizers, especially in Adamas University, because they have thought to organize this type of e-workshops. Because what I understand that the government of India rules and regulations, especially on animal research, they also encourages this type of workshop because this type of workshops will give an additional value in the courses of UG and PG because maybe somehow they are unable to handle number of animal simulation experiments. So for that, I want to thank them that they have thought of it to arrange this type of workshops. And I also want to congratulate them because the participant is very significant also. So before I start, I thought that I will be giving a common viewpoint of the animal research. That what are the common viewpoint for a layman or for a common man. Okay. So they thought that when medicines and other treatments for humans is created by the scientists and doctors maybe, so animal experiment is tested upon in that time only.
Sir, sorry for the interruption. I think the participants are not getting your voice properly. So better you disconnect the speaker and directly connect. Yes, that will
Okay, is
be
it okay now,
fine.
Sushmita?
Yes, sir. Yes, sir. Better, better, sir. Yes,
Is it better now?
yes, sir. Better, far better.
Okay.
Yes.
Okay, so what I thought that at the beginning I will be giving some of the viewpoints of like for different person in the society, it's like layman. So what they thought about the animal research. So actually they thought that when the medicines and other treatments of humans is created by the scientists or doctors, so that time the animal is uses for the test. Okay. So then next is what are the scientists' viewpoint for the animal research. They thought that study of animals when there is no alternatives and it is impractical or unethical to study human directly. So that time that means so just to initiate the clinical trial we have to confirm it in the animal models and that's why the scientists have used the animal models. So this is the scientist point of view. Advocate point of view. So as know that advocates what they can thoughts about the rules and regulations. It is important that they will be thinking about the ethics committee rules and regulations because they will thought like that way. What are the rules? What are the regulations and all? Next is what are the governmental point of view? Government also knows that experiment on animals are very strength of modern medical science and scientific research. But what is important that the government will be thinking at cost, risk and benefit ratio. So is it what are the outcome? What are the cost I am spending for the animal research? Because governmental point of view will be like that. Okay, so next is what are the animal activists or some of the social workers' point of view of animal research. So they will be thinking that mice and medicines, what are the right for them? What are the right for humans and what are the right for mice? And they will be also a strong supporter of animal welfare. and that's why they will obviously proposing some of the alternative methods if it is applicable. And I think all the UG and PG students knows that alternatively we are using number of simulation experiment and all because of number of government regulations and everything. So that's why this is a common perspective, that what are the common viewpoint of animal research in our society. But actually, what is animal research? So I think the last speaker also told very perfectly. I have seen very 2-3 slides at the last, and his topic was very interesting also. Why, when, and how, and what. So what is the pharmacological point of view? The animals are biologically similar to humans, first of all. Second is, the animal are susceptible to many of same health problems like cancer, diabetes, heart disease, and etc. So that's why we can manipulate some of the disease model in the animals. So that's why we can test some of the molecules in the animal models. And obviously, with a shorter life cycle than humans, the animals model can be studied throughout their whole lifespan and across the several generations. So these three is the most important point for which the animals are used for the experimental pharmacology. Okay, so the uses of animals in some form of biomedical research remain essential to the discovery, not only for the cause, but also for diagnosis and treatment of disease, not only for human, but also for animals. And this is a very simple play card that I got it from the CPCSEA training. It's very important and very interesting and significant, what I believe just from my heart, that the animals are telling that we don't smoke, we don't drive, we don't and wear makeup and perfume, we don't use paint, we don't drink alcohol, we don't drop bombs. Now everyone is knowing what are the importance of bombs and what is going on in the world. So they don't even drop the bombs. We don't take drugs. That means here it is not the medicines, it is the some of the narcotics and all. Just because of humans do it, why should we suffer through the experimentation? So I think this is the message that is issued by CPCSEA only because of public interest. That this is telling that how much ethical consideration I have to think before I start the animal experimentation. Okay, so this is giving an important message to us. Okay, so I thought I will be discussing what are the different stages of animal research in the drug discovery process, and for that I started with the three phases of drug discovery. One is the target selection and validations. Second one is the discovery phase, discovery in terms of efficacy study, the optimize the lead and lead optimizations and validations. And third one is the development phase. So development phase means it is especially for the toxicological studies as well as the clinical trial and post-marketing surveillance. So nowadays, the companies worldwide, not only in India, but also in the other some countries also, they started the discovery process with the disease, or we can say the target-centric approach. So what is the meaning of target-centric approach? That means the companies or the funding agencies, they specify the target first, that at what particular disease I will be inventing my molecules. Not like it is, because earlier it was in a compound centric way. What is the meaning of compound centric way? That means I am having maybe 20 or 50 number of NSAIDs in the market. So I will identify that what are the similarities in that particular molecules or particular drugs available in the markets. So based on that similarities, I will make my own molecules. Then I will do some of the animal experimentation. So this is the compound centric approach of drug discovery. But somehow it is not well accepted by the scientists. But nowadays, the funding agencies and the companies, they prefer target-centric approach. Target-centric approach means they will do the studies on disease mechanism first. Disease mechanism means what are the pathophysiology of the disease, what are the etiology of the disease, what are the biological targets. So how I can manage the particular disease. And based on that they will also be doing on the molecular studies of that particular targets through QSAR, the quantitative structure activity relationship, as well as high throughput screening for specifically for the candidate search. And once the initial candidate is found, they will be testing the same thing on animal models to see the initial efficacy of that particular candidates. And once the initial efficacy is done on a specific species of animal, especially on inbreed animals, transgenic animals, to see the activity in terms of agonist or antagonist, or maybe it's a enzyme activator, or maybe it's an enzyme inhibitor, in what angle they will do it. But in the next, what is important, that I need to specify my target, that my molecule is working in that particular targets. So I need to identify the receptor or ion channels or the transporter or maybe some of the enzymes or what are the specific signaling molecules that is either inhibited or activated by my candidate. So that has to be identified. And next is now I am having a initial assumption on my molecule that it is giving some effect, but I need to go for lead search. Is it ultimately working in the particular disease mechanisms? If that animal model is ultimately similar with the human models, so that is a question mark. And for that, I need to develop a specific assay, so that will be highly equivalent to the human disease mechanisms. And I need to also study for the chemical diversity. So that is the meaning of lead search. And then the next is the lead optimizations. So the lead optimization means the specific selectivity of the molecules with a specific target only. And once the lead is optimized, lead is searched, lead is optimized, it is very important that I have to see the safety of the molecules. Lead safety molecules. That means I have to thought about the toxicological part of the molecules. See, one thing is interesting in animal research. In the animal models, the efficacy is studied first and toxicology is studied in the second. But what happened in the clinical trial? The clinical trial is studied with phase 1. So phase 1 is conducted in the human volunteer, healthy human volunteers. So that means the safety will be concerning first and the efficacy will be in phase 2 and phase 3. Okay, so we know that phase 2 is only with a limited number of patients with a homogeneous populations in a single center study. But in phase 3, it is a heterogeneous population, more number of participants will be there. And even though if it is successful in phase 1, phase 2 and phase 3, it will go for phase 4 as well as the approval process and it will come to the markets. So what important in this slide is that initially in the animal models, the efficacy will be studied first. Then before starting the clinical trial, the toxicological part has to be studied. So this is very important. So this is the reference, complete reference as per the Government of India guidelines. This is compendium of CPCSEA. So where they have mentioned the animal care, the benefits and ethics of animal research, the protocols and everything, they have given the guidelines in form of guidelines. So all the protocols, all the rules and regulation is mentioned in this compendium. So I've given that much of reference for that, reference purpose only. But what is my personal point of view is that we have to understand that what is the recent trends of animal research. I'll be showing one slide that what is the success rate of animal research. That means if I get a effect in animal, ultimately is it coming in the same effect in human? So that indicates the success rate. So I will be showing that what are the success rate and why it is important to understand the trends of animal research all over the world, not only in India. So what is going on outside? What is the more scientific models of the disease and all? I will be showing some of the videos also on that. This is very conventional way of imaging an animal house. So I have given this image that was having with me from my BPharm time, that everybody is having a thought that animal house is just like that. It's having a plastic cage, plastic bottles, having a metal rod, and it will be kept like that. But is it actually that? What's the world is demanding? And what is the specific ethical consideration that is coming in our mind? I'm not telling that if the animal is maintaining like that way, the ethics is not maintaining. I'm not telling that. But the question is that the first point that will come to a pharmacologist is all the cases are in equivalent environment. That will come to the first questions. Because the cages that are in the first rack, they're not in the same environment in the third or fourth or last rack. So automatically, if the animals are not kept in an equivalent environment, the data will be invalid. So that means I'm telling, maybe I'm ethically correct, but maybe I'm scientifically wrong. That means my work is useless. So that's why what we need to understand, that what CPCSE is also telling every time, that we have to be ethically restricted, ethically strict, but not compromising the scientific quality. So that means you have to understand at what level I will maintain the ethical guidelines and all, and at what scientific outcome I will concern. That is also important. I will be showing that what are the advanced animal houses is looking like that. This is an animal house. It is obviously, you can say it is an IVC cages, individually ventilated cages, IVC, as you can see. So what is the specialty of this system or devices? As you can see, this device is having an air handling unit. That means that air handling unit will filter the air with number of HEPA filtration process and all. They will purify it. They will maintain the temperature of the air. They will maintain the sterility of the air. They will maintain the humidity of the air, and they will send it to the each and every cages, because each and every cage is having a air in and out channel. Just as you can see it here in the top, that air in and out channel is also present in the rack, and the same knob is also present in the cage. And here the cage is specially designed. What is the specialty in this case? So there is no provision to come air from outside to inside. But what is important here, that is a safety valve. As you can say, this is known as the breathing window. Sometimes maybe somehow there is a power cut, maybe something malfunction in the machines, animal will die. So for that, what they did in the cages of the animals, they given a breathing window. But that breathing window is having a HEPA filter, so that every time the air that is coming from outside to inside is also sterile. What is important in this system, that all the animals or all the cages are in equivalent environment. I hope so that everybody is understanding that the air is coming from the same system, the air is going out from the same systems. So each and every cages presenting here in the IVC rack, or we can say individually ventilated cages rack, is having a same environment. So the chances of individual variations will be less. Okay, I will be showing some of the videos also with the same system, that how this IVC system is working. And number of academic institute in West Bengal, as well as number of CROs, is having these IVC systems. I'm not telling that all the academic institute is having, but number of academic institution is having, and number of CROs, because for CRO it is a compulsory. Otherwise, they will not get the GLP as well as ALAC approvals. Okay. If it is a question of breeding, I have to be more conscious about ethics. Going about in details about the breeding purpose and all, because if it is a breeding purpose, the ethics committee rules and regulation is completely different. They are very strict, because I am concerning about the breeding of animals. I'm not going in details, but I wanted to show these nice pictures, how they are actually maintaining in the animal house for the breeding purpose. And this is a very simple animal house having a IVC systems. And as you can see, the IVC system is having a wheel on its rack. So if you need to move it, you can easily move the entire system. It's not like that individual case has to be moved. The entire IVC system can be moved from one room to another room, and that can be handled easily. And there is no question of the outside environment and all, because outside air is not going inside. Everything is controlled by the air handling only. That is important. This is the fact. I got it from some of the British medical journals, some of the reputed journal in medical science, and they are telling, you can see in the statement, more than 90% of the animal experiment failed to lead to treatment to humans. More than 90%. That means success rate is 10%. The question is why? Question is why is very important. If I am ethically correct, but ultimately I have to understand that my outcome, what is my outcome? Is it, if I am ethically correct, but is it my outcome is giving a scientific concern? No. Then what is the importance of ethically correct? Okay. So this journal is very good journals in medical science, and they are telling, it is a report in 2014. So the question is why? The question is why and how? The first questions comes to the pharmacologist is that concerning to the individual animal variations. Individual animal variations in term of strain, in term of maintenance, in term of handling, in term of feeding. I will be showing some graph also given as per WHO, that how fit or how the animal care is giving variations in the biological parameters of some of the serum parameters. I will be showing that particular graph also. So that indicates that how much is important to have an ethical handling of animals, ethical care of animals, along with the ethics rules and regulations. This is the, as I told, that I will be showing the IVC system completely, how it is working. And I got it from the Orchid Scientific Company. Green is the inlet and red is the outlet. This is the cage. This is the design of the compact cage system. Okay, so I think everybody enjoyed the systems, because what is important in this system is that first time I have seen this in my postdoctoral research, but now it is very commonly available in West Bengal also, and obviously in India also. Not that much of costly. It's very simple and very convenient cost also in that instrument. Okay, so this is something I got very interesting to show to all the students and obviously all the participants, that this is the guidelines given by WHO for QPBR, Quality Practice of Biomedical Research, and see how the food consumption is giving a variations in respect to the animal care. If the animal is kept entirely in wire mesh, food consumption is very high, and if the animal is just maintaining in a plastic case without any litter materials, that means without any bed on the cage, it's in the average food consumptions. And if the animals is in plastic cage without the litter materials, or just with the litter materials, the food consumption is very less. That means it indicates that how animal care is important to give an ultimate scientific outcomes. Because if the animal's food consumption is not appropriate, if it is not uniform to all, it will give a variations in the ultimate data. Second, as I thought, I will be showing the second graph, what given by WHO as per QPBR guidelines. The PBR is easily accessible in the WHO website. If someone is interested to see it, details guideline is there, that what are the quality practice in animal research for maintaining in the biomedical scientist. See, influence of variables in the CPK value, the creatinine phosphokinase value, depending on the anesthesia they are using in animals. If it is carbon dioxide, even though not only because of anesthetic agents, but also at what route you are just collecting the plasma or blood, that is also important. And see how much variations are there: 100, 125, 86, 89. It's not like 100 and 101, not like that difference of the value. That means the collection process, handling, the specific process of anesthesia, the specific process of euthanasia, how you are using, that is ultimately affecting your ultimate data, and that has to be in the consideration in the study. That means how much concern is required to make the animal model or animal study reproducible is very important. And what the WHO told is very clear, that they told if there is a sound science in the methods, not accepted. If there is a sound science, as well as we can say if it is only in the quality practice or quality ethics, then also not acceptable. But if it is both, that means if your models or if your experimental design is ethically and quality practiced method are maintained along with it having a sound science, then only it will be accepted by the worldwide community. Otherwise, it will not be accepted. It's very important. So once my topic is on animal handling, the e-workshop on animal handling. So one thing I believe personally, that in pharmacology there are two major challenges to the animal model development. One is to induce the disease in animals, and second, to collect the biological samples from the animals. This is very, very important and very challenging to a pharmacologist, because being a pharmacologist, what I believe personally, that these two is very challenging. And in these two only, I have number of ethical concern as well as number of what I can say experimental skill setup that is required to make the data reproducible and to get an ultimate scientific outcome. The needle is basically is determined by the needle gauge number, and as I have mentioned, the lower the gauge number, the wider the diameter of the needle. This is very important for everyone to understand. So lower the gauge number, diameter will be more in the particular gauge number needles. So the gauge number is important at what particular route you are giving injections. Maybe it's interperitoneal, maybe it's a subcutaneous, maybe it's intramuscular. The gauge number is important in that angle. Not only for that, it's important from animal to animals. If I am handling animals, I am giving a subcutaneous injection in mice, maybe the gauge number will be different. But I am giving a subcutaneous injection in rat or rabbit, maybe I will take a separate gauge number of particular syringe and needles. But again, I am telling that it depends on personal skill setup. Sometimes maybe someone is comfortable in 26 gauge number for giving a subcutaneous injection, but maybe someone is very comfortable in 20 gauge number. He is having a specialized skills on that, because in industry the skill is very important. And next is the needle's length. Needle length is also important, because length is determining that at what route you are giving injection. If it is a tail vein injection, I will not take that much of length of the specific needles. I will take a very small length. But if I need to give intermuscular route, I have to take a very higher length, 1 to 1.5 inch of length. Next is the syringe size, not the needle, syringe size. Syringe size is important when I need to inject as per the quantity of the volume of the particular drugs. If my volume is very less, I need to inject very less quantity of volume, I can take a very small syringe size. But if I need to inject more in volume, I can take the separate syringe size, but I can maintain the same needle size also. Okay, so this is very important to understand. So in experimental pharmacology, it's first important to understand that in my experiment or in my task, at what type of needle I will select. It's very important, because what I believe personally, whenever I start animal experimenting, I thought like that way. What type of gauge number I will take, at what type of length I will do, at what type of syringe size I will take. That is important, because in that only I can control my animal suffering one by one way. This is a very good reference. I got it from Becton and Dixon company, that at what gauge number it is available in the markets. So what I prefer personally, it is 26 gauge. As you can see, 26 and 28, it is applicable for all common route. So 26 to see, as you see at the color, the pink color is for intradermal injections, intermuscular is light green color, and the light yellow color is for subcutaneous injection. And the common is 26 and 27. So you can use, because again, I am telling that it depends on your personal skills. Maybe I am comfortable by giving a intermuscular injection at gauge number 18. I am comfortable. But conventionally, the common way, that 26 and 27 is very conventionally used, and it is used for all the routes of administrations. So similarly, in needle length also it is important. So I put thought that what route I am giving injections. What is the purpose of using a needle? Needle can be used for two purposes. One is to give some medications to the animal's body, or sometimes to collect the blood from the animals. In both way it is possible. So in that angle, I have to thought about it, that if I am injecting something, if I am injecting some of the inducing agents or maybe some of the medications or some of the test compound, so at what needle size I will take, at what gauge number I will take, at what syringe size I will take, that is important. Otherwise, you are not thinking about the animal suffering and all. I'll be showing some of the equations of animal suffering also in the last few slides also. So first I showed what are the techniques that is very important to understand for intravenous injections. As you can see here, the intravenous administration of any test item. It is not like that every time we are injecting the test item, but sometimes we are injecting the inducing agent also. For example, I need to make the animal diabetes. I need to give a intraperitoneal injection of STZ. Okay, so maybe I need to make a skin cancer. So maybe I am giving a chemical carcinogens to the subcutaneous injection. So it is not always true that every time I am injecting the test drug to the animals. Maybe I need to inject some of the inducing agent also. That is important. And what is important, just as because you are giving an intravenous injection, it is so much painful. So sometimes the restainer is used. Restainer is very simple, although the term is very difficult, but it's very simple animal holder, so that the animals will be comfortably fitted there. I can just take the tail or maybe the biological part out, so that I can give a very simple intravenous injection. The preferable gauge size for intravenous injection is 26 as per my concept, but again I am telling it's vary from person to person. Okay, so 26 is perfect for rat and mice, but if it is for rabbit, I will be considering to giving the intravenous injection in the air vein. Is very easy to give in rabbit. So that's I'm telling. At what animals you are taking, at what route you are injecting, and at what volume. Depending on that, you have to select the needles. That is important. Next is subcutaneous injections. So the subcutaneous injection is very common, and number of times we have used in our experiment also. So it is preferable that it is given behind the neck and shoulder blades. So what is the process? It's very simple. Just drape some of the skin so that you make a tent. This tent is very important, and it has to be given inside the tent. The standard size of needles recommended for giving a subcutaneous injection for mice and rat, it is 20 to 26 gauge, and needle size vary from 0.5 to 1 inch. Again, I am telling it's vary from person to person. I have given as per the standard procedures, but again, I have seen number of pharmacologists. They are very comfortable by avoiding these rules and regulations. They are very comfortable with some other ways because they have highly qualified skills. As you can see, it's very easy to give subcutaneous injections. So sometimes the animal don't need to anesthetize for giving a subcutaneous injection because it is very easy and convenient. Only you make a tent, inject it accordingly as per the volume required, and the preferable size of the gauge is 20 to 26, depending on animals, obviously. Interperitoneals, as because the interperitoneal cavity is very huge, so the absorption rate is very high. So sometimes the experimental pharmacologists thought to administer the test drug in the interperitoneal cavity because absorption will be very high. And it is also given very easy that the interperitoneal injections are typically made in lower right or left quadrant, not in the midline. Very important. Not in the midline. Lower right or left quadrant. Why? The chances of infecting the internal organs will be less. Got the points? And the preferable size of gauze is 26 to 28 gauge, and the length is 0.5 inch, because here I don't need that much of length, 1 inch or 1.5 inch, because I have to give an interperitoneal injection. Okay, so what is happening in some of the labs that maybe it is not available, the gauge number is not available. I am giving interperitoneal injection, but my size is 1.5 inch. So what is that? Means you are doing an unethical practice, because the possibilities of animal suffering or infecting the internal organs will be more in that case. So that is very important to understand. Intermuscular, very simple. So for sometimes intermuscular is also given using a restainer, some of the animal holders, so that I can access the thigh muscle. I can push it in the thigh muscles. And the intermuscular injections is to be given in deep into the muscles. Use needles long enough to penetrate the skin, long enough. I need maximum size of needles here because I have to give intermuscular injections. and the subcutaneous tissue and fat to reach the muscles is important. The needle should be entered the skin's perpendicular to the skin surface, very important. Muscles not in the subcutaneous route. So my objective is to give intramuscular injection, not subcutaneous route. The preferable size of gauze number is 24 to 28, and here the size is more, 1 to 1.5 inch, not like intraperitoneal injection, because I need to cross the needle through the fat layer and through the subcutaneous layer. So that's why the selection of gauze number and needle size is very important for giving an intramuscular injection. Because ultimately what is happening, if it is not properly given, maybe that is ultimately affecting in your study outcome data. This is the most convenient on the oral feeding needles. Everyone knows, and it's very common that sometimes, because in pharmaceutical industry they prefer the drug to be active in oral route, because this is having the highly patient's acceptance. And if it is not active in oral route, the formulation scientist will make it orally active. So in pharmacology also sometimes we are forced that why not in oral route? You can give the medications in oral route. So for that we have to use some of the oral feeding needles as I have given. It is available in different gauze number starting from 18 to 8. Here also same thing. Less the gauze number, more the diameter of the needles. It's very important. So the length is very important. At what animals you are giving the oral injections or oral feeding. If it is a small size rat, and if it is a healthy adult rat more than 300 gram weight, in both cases the gauze number and length of the specific needles will not be same. What is happening? Maybe if your animal size is high, but you are giving a very small size of the needles, so ultimately it's not going to the stomach. So what is happening? Animals will vomit that particular test item. So how is affecting? So your data is affecting in your data. Ultimately, why the problems will come? Because animals will having a tendency to vomit it if it is not properly going to the stomachs. So the selection of gauze number and length of the needle is very important to giving an oral feeding to the animals, especially in rat and mice. It's very important. I've given some of the videos, I got it from some of the references, that how I've given IP and oral, how it is given actually. This is just for reference. As because it is a e-workshop, I thought I will be giving number of videos to make the students understand and make the participant understand. This is for the oral feeding. Very simple and convenient, but you have to thought about, as I feel personally, I have to start thinking of needle size, needle length, syringe length, what route I am giving, at what volume I need to inject, at what type of animal I am using. That is very important. It's not like that I came to animal house, whatever it is available I am giving, not like that. Because you have to understand the scientific outcome. You have to understand about the reproducibility of the data. That is also important. And you are not thinking about the animal suffering. You don't have that appropriate number of syringe and needles, and you are forcefully injecting to the animals, and ultimately animal is suffering. So it is unethical practices for the animal house. So next is whatever till now I told, it is the giving of injections or handing of needle and syringe by giving an injection to the animals. Maybe it's a test item, or maybe it's an inducing agent for the disease, whatever it is. And I don't care for that, but the technique you have to understand. If it is a test item or if it is a inducing agent for particular disease, it doesn't matter, but my skill for injection has to be very perfect. Next is, as I told, the challenging to the pharmacologist is the collection of blood. It's very important, collection of biological sample, not only blood. Some of my students in M-Pharm, they are isolating the pineal gland. So it is very important to identify that what is the pineal gland present in the rat brain. It's very challenging. So similarly, the blood collection is also very challenging, because sometimes I need huge quantity of blood, maybe 5 ml. I'm getting 1 ml. So how I will manage that? That means I need a specialized skill to collect the blood from the animal, so that I can do all the possible molecular studies to give a valid conclusion on the molecular mechanism of my molecules. That is important. So the maximum biological sample collection is very important. So whatever I am showing now is the process of collecting blood from the animals. And this is I got it from a Nature publications is very recently in 2015. I got it. What they are telling: when collecting a small volume of blood, retroorbital bleeding with a thick capillary and without anesthesia causes the less stress in mice. Whereas jugular vein bleeding and facial vein bleeding causes the most stress, and saphenous vein bleeding causes the most lasting damage in mice. So what is important in this outcome, in this paper? That I have to understand at what method I am collecting the blood. I have showed the WHO guidelines also. They told that collection of blood is also varying some of the parameters in the blood, in the plasma. Not only because of the anesthetic agents I am using. I know that some of the anesthetic agents are now banned for using in animals, but the method of collecting of blood is also important because your data will be varying on that angle. So this is the diagram of some of the restrainer or animal holder conventionally the pharmacologists are using in lab. So it's very convenient at not that much of high prices also. Number of size it is available, and it is available for all types of animals, even in rabbit, even in dog, even in cat, even in baboons, monkeys, and obviously for mice and rat also. So this is the few snapshot of restrainer, because sometimes if I am forcefully giving an injection to the animals, animals are suffering maximally. So I have to give them comfort in the restrainer, because animals are comfortable in the restrainer only, because my access of tail, access of thigh muscles will be very easy in that time if the animals is kept in the restrainer process. So this is the most convenient method, saphenous vein bleeding methods for collecting blood from the animals, because we know sometimes we uses retroorbital plexus. We uses sometimes collect the blood directly from heart. That is also very much painful. So what is ethically correct, I will be discussing at the last, but I am telling about the process acceptable by the Government of India guidelines or as per CPCSA. The saphenous vein bleeding, the technicians puncture the lateral saphenous vein with needles at a shaped location above the knee and draw the blood into the capillaries. It's very convenient method. I also used in my postdoctoral and in my PhD research like that way. Because if I need to collect the blood multiple times in a day, this is the best method. Because sometimes we are concerning about the PK study, pharmacokinetic study, that at what different time intervals my drug is absorbing, or maybe how much is the plasma concentration. So in that time, this is the best method for collecting the blood. Very simple and convenient. And animal also is having a minimum stress. If I need, again I'm telling, if I need several times of blood with a small quantity for maybe for 3 to 4 times a day, or maybe for more than that, but this is not the perfect choice if I need only one time of blood for animals. This is not the perfect choice. What is important? What is the important skills for collecting this blood? The capillary that I am using here. This capillary has to be soaked with heparin before taking the blood. Otherwise, the blood will float in the capillaries. I will get maybe 4.5 ml, but later on, I will not get the blood from the capillaries because the capillary is having a blood clot. So what is important skills here, that before first what I will do, I will make a punch of by giving a needles, as I have shown in the third pictures. Just make a punch by giving a needles in the saphenous vein. Before that, you soak your small capillaries with the heparin. Heparin is very convenient. It is very convenient to use as an anticoagulant. Then once the punch is done, then you touch the capillaries in the specific point of the saphenous vein where the punch is done. Automatically the blood will come automatically, and it will not stop flowing. As per the requirement, I need 1.5 ml. I need 1.5 or maybe 1 ml. As per the requirement, you can just simply remove the saphenous vein as well as from the capillaries from the specific positions. The blood will stop. Very simple techniques. The next is tail vein. It is also very painful, what I believe personally. First one is tail vein and second one is retroorbital plexus. As I told, for a short-term blood collection, retroorbital plexus is the number of choice for the pharmacologist, and it is proved it is having a less pain. Initially, we thought maybe I am injecting the retroorbital plexus. It is very painful, but it is medically accepted and scientifically accepted that the retroorbital puncture is very less painful to the animals as compared to tail vein also. So tail vein is very simple. Again, if I have appropriate choice of syringe and needles, I know that I am using from rat and mice. If it is rat, the tail is very thick. If it is mice, the tail is very thin. So depending on type of animals, I will select the gauge number, and accordingly, I can initially wash the tail with maybe for alcohol, 70% alcohol to clean it properly, to make the tail vein visible. Then I can inject it and I can take it with the vacuums, vacuotiners and all. And for the retroorbital plex is very important and it is very convenient. In my MPharm and PhD time also we have used that techniques. And sometimes it is recommended that you can use some of the anesthetic agents before you taking the blood from the retroorbital plexus. Anesthetic agents like isoflurane that can be given in a inhalation process. As you can see in this just in the left side pictures, the animal's nose is kept in an inhalation chamber. Actually, what is coming from there? It is coming the isoflurane, 3% isoflurane with oxygens to make the animal anesthetized, to giving the minimum pain while collecting the blood from the retroorbital plexus. And it is a very, very convenient method. It's very simple and convenient. Next, this is very important, and this is the example of cannulations, jugular vein bleeding. So blood can be collected from the jugular vein bleeding, as well as I can make a cannulation process. So suppose if I need a multiple times of blood collection in whole day, or maybe I need to infuse something for long term, maybe for saline, maybe for dextrose solution, maybe some drugs, maybe some of the protein or recombinant medications like that. In that time, what I do, I make a cannulation, as you can see it in the right pictures, that the ligature is made with the guided wire, and the guided wire will be opened through the dorsal regions of the subcutaneous side. Because if the specific wire is open in the jugular vein side, animals will having a tendency to bite it automatically. They will try to disturb it because they will feel uncomfortable. So what is happening in the lab, that the outer part of the wire, it will make a twist, and the outer part will be open to the dorsal regions, so that they don't have the access to bite it. They don't have the access to destroy the system devices of the specific cannulations. And when it is required, I can use the cannulation to take the bloods, or I can use the cannulation to induce some of the medications like that. So this is the best method if I need some of the pharmacokinetic studies, or if I need to infuse some medication to the animal's body for long-term purpose. So this is a very specific diagram video I have given to see that how the blood is collected from by using cardiac punctures. This is one of our MPharm students, they are doing along with myself. This is the blood collection from cardiac puncture. Although I feel it is very painful, but as per CPCSA, in special cases you can do the cardiac puncture also directly from the heart. Obviously with the anesthetized animal, not with the unanesthetized animals. You have to feel the heart first. You have to feel the heart position first. Then you have to use 26 gauge of needle. This is a 26 gauge needle. This is myself and one of my MPharm students is doing the experiment. And by this cardiac puncture, you can get at least 3 to 4 ml of blood from adult rat. And for mice, it is for 1 ml, almost. So 3-4 times you can get it. But one thing is important, that here in this method, so while you are anesthetizing the animals should not die. That is important. You have to anesthetize, because from a died animals, you cannot take the blood from the heart. That is important. So that is a special technique or special skills, that how much I will anesthetize. That is important. Otherwise, if the animal is dead during the anesthetic process, you will not get the blood. Sorry. So next, so till now I told about the animal handling. The two important aspects, one is giving injections for any test item or the inducing agents, and how we will collect the biological samples from the animals, especially blood, because the blood is the most difficult part that is very difficult. Specialized skills are required to take the blood. Maximum blood is important. So here, if the ethics is concerned, I always prefer to simplify the ethics by these equations. Very simple. This is my personal feelings, what I believe. The total animal suffering in animal experimentation, just you think, in animal experimentation, the total animal suffering is equal to individual animal suffering into duration of experiment into number of animals. Very simple. I think everybody will understand that. If the number of animal is more, the animal suffering will be more. If the duration is more, that means if my study is having a 30 days of specific duration and someone's study is having a 15 days of duration, so 30 days will be having a maximum suffering. Although I am using IBC cages, there also it will be suffer because I need number of doses, I need to induce the medications, I can take the biological sample, so much way the animal is suffering. Okay, the question is how we can control numbers ethically. The government of India or CPCSA, as we know that the CPCSA is the ultimate authority for maintaining the ethics in animal research, they recommended 3 years. Initially they told 3 years: replacement, reduction and the refinement. Replacement means you cannot start the animal experimentation at the beginning. Is it, they will ask that, the committee will ask the questions, is it there is an alternatives method? They will ask the question first, because being a CPCSA nominee, I also understand that I need to ask first questions. Is there is an alternative method you have studied, or you got the same hypothesis with some alternative methods? That is the concept of replacement of the studies. Suppose I need to use rat, or maybe I need to use baboons. The ethics committee will ask you the questions: is the same study is possible in small animals like mice? If it is same, if it is possible, so why you are taking higher animals like baboons or monkeys? Why not in rat or mice? Similarly, they will ask the questions: is there is any alternative method like in vitro, ex vivo cell culture and all? Has the studies done on that particular concept? If it is yes, then they will give the permissions. So ethically will come from there that I have done all the possible initial screening methods. I have done in vitro, I have done studies on cell culture, and I have the valid data in my hands. Then only I can apply for the animal models. So that is the concept of replacement. Then the question is the number, reduction, because number is important factor for animal suffering. If I am taking more in number, animals will suffer more. So I have to understand that at what particular number I will take in my study. I can take 100, I can take 10 in each group, I can take 6, I can take 4. You have to understand the statistical part of this particular protocol designing also. At what number I will use, because number is important in terms of the specific animal suffering. Okay, and lastly, the CPCSE also recommended one more R in the last time, that is the rehabilitations. This is the question of ethics. It is not like that once the experiment is done, you can throw the animals outside. Not like that. So what is the meaning of rehabilitations? The animals, if it is not sacrificed in the study, they has to give freedom for food, freedom for their common environment and all, and you have to rehabilitate them for their life, till their life. That is the concept of rehabilitation. So that was the fourth R that was introduced in last few years by the CPCSE. So first of all, I have to think, if it is a question of ethics, I have to think at what number I will take. I can also take 1 in each group, but is it statistically valid? No, because if it is 1 in number in each group, statistically is not valid. So ultimately my study is waste, my study is useless. That means the animal experimentation is useless. Why you are doing that? So you have to understand the importance of number. At what minimum number I can take? You have to take minimum, not maximum. You have to understand that to give a valid conclusion, at what number I can take according to my designing of the protocols and everything. The next is the duration. The animal must experience only the minimum pain or brief discomfort when they are used in research. Each and every step, whenever I am giving injection, whenever I am taking blood, I have to be very concerned about the pain, what the animal is getting it. Why it is important? Not only what I believe, not only in the ethics purpose, but as I told that the collection method, animal care, also influencing your data. That is also important, because if the animal is in stress, all the biochemical imbalance will be there in the humans or in the animal's body. You will not get the ultimate data, actual data as expected. So that's why not only because of ethics I will maintain the animal suffering, but also it is important to get a very good scientific outcome in the ultimate data. So to control the duration of the experiment, I have to understand the endpoint analysis. I can give a conclusion of a study by doing 8 days of experiment or maybe 1 month of experiment. So what are the difference? Is it the conclusion coming in 8 days is not sufficient, is not significant? If it is not, then I can go for 30s. But why I'll go for 30s? You have to justify that. Because duration, if it is more, animal suffering is more. Whatever you are telling, you are giving the specific freedom for the animals. You are giving a very comfortable environment with RO water, heavy specified sterile food, with an ventilated cages and everything. But even that also the animal is suffering. So that is important. And the last most important thing is that individual animal suffering. How I can control individual animal suffering? Suppose in my lab, suppose I'm giving the example in my lab. In my lab, some student is very good in animal handling, but some student is not good in animal handling. The student who is not good in animal handling, she need to do the experiment. I don't have any options because it's not like that. Being a teacher, I will say those who are good, he will do for him or her. Not like that. He or she has to do it. I know that if she or he is doing the experiment, animal suffering will be more because he is not good in handling. So ethically, what I need to do, that I need to send her or him for some training because he or she needs attitude or personal skills by doing some training. That is important. Only because of training, only because of skills, I can control the individual animal suffering. So see, in industry, I know in CRO, if a person is very good in blood collection, every day he will doing the same job just to give the minimum suffering to the animals because he is very good in that. He is having a skills of blood collections. Someone is very good in giving IV injections. That person is doing every day because the company or the team leader will not say other will do for that because he knows if other is doing the same job, the animals will suffer more. So that's why I'm telling the skill how much it is important. So if somehow it is not possible, I can send a person for training so that he is becoming the skill, he is having the skills so that he can give the minimum suffering to the animals. So these equations, I believe very just from my heart that if I am having ethics in these 3 points, that total numbers, durations, and individual animal suffering. So before I start the animal experimentation, I need my personal skills, attitude of animal pain, that I think that if I am giving an injection, animal is also suffering. He's having a pain. It's not like that I have to give an injection, I will give it without anesthesia. Not like that. You have to see the protocols, you have to see the guidelines, what they are telling. Maybe in some studies, some of the anesthetic agents are interfering in my data. So what alternatives I can make it? At how comfortably I can give injections, how comfortably I can take the animals' blood collections, how comfortably I can euthanize the animals, sacrifice the animals. Euthanasia means the animal death with minimum suffering. That is important. And what method it is given by the CPCSA, that is important. So this equation is very important. What I believe, the total animal suffering is equal to individual animal suffering into duration into numbers. So if you need to thought about ethics, you have to thought these 3 points, as I told. Duration and number, I can control it with the statistical methods and maybe for the protocol designing and all, because duration is very important. At what duration I can give a valid conclusion, that is important. Okay. And lastly, the individual animal suffering depends on your skills, your attitude, your personal skills, attitude, and for that you need a training. And that's why I thanks the organizer, that everybody, I know that for a biomedical scientist nowadays it is a very government restriction that we cannot use the animals and all, but this type of workshops and or maybe for the webinars is helping the students to make understand that what are the ethics, what are the handling process and all, that will benefit in future also. So lastly, this is my last slide, that personal care. personal care and hygiene is very important in animal house. You know that in animal house, as per GLP and ALAC or CPCSEA, in animal house, mobile phone is also restricted because the radiation is also affecting the animals. And if the radiation is affecting animals, your data is also affecting. Okay. So a very good personal hygiene is also important to maintain in animal house. And also obviously in the microbial safety, as I have seen here, this is my pictures in my postdoc, that every day we are required to maintain the microbial safety of the animal house. Every day you keep the petri dish and check it, what are the microbes present outside, even though it is IVC. But even though it is IVC, animal are inside, but then also I need to maintain what are the environmental microbes are present. Okay. And this is the pictures in the top, that doing some surgery with number of protections, number of personal care and hygienes, and the animal attendant. This is some of the attendant in my time. So they, how they are cleaning the animals cages and all, and how they are maintaining the hygienicity and all. This is very important because that is also important in term of ethics, what I believe personally. So this was my last slide. Thank you. And if someone have any questions, you can ask me. I'll be happy to answer as per my knowledge.
Thank you very much, sir, for sensitized us regarding the animal experiments, animal handling and care. So I think all the participants have learned a lot from this presentation, and in future also we organize this kind of workshop or webinar so that we can informed regarding this kind of animal experimentation, animal use in experimental pharmacology. And thank you so much, sir. So I am requesting the participants, if you have any questions, any doubt regarding today's session, so you can write your question in chat box.
So what I believe personally, that maybe it's a e-workshop. I know that the skill cannot be possible by just observing the videos and all, but it needs a special hands-on training. So if it is possible, I think all the faculties in Adamas University, they can arrange that type of workshop also.
Sure, sir.
Outside, that means excluding from the specific courses and curriculum, additional to that. Because
Yes,
I know that in course and curriculum, we don't have that much of skill development program for the students, especially concerning to animals, as
yes,
per the Government of India rules. So that is also important.
Sure, sir. Sure. In future, I hope this kind of training or workshop will be helpful for the research scholar as well as students also. So I think there is no questions from the participants. So one question is there. So is
Yes, yes,
there
very
any
good.
statistical method to calculate the minimum numbers of animals required for a study?
Yeah, it's very good questions. It's asked by Anusha. Okay, it's a very good questions. I also thought whenever I have designed some of the protocols in my PhD also, I thought about that. So see, as per the common concept, if it is a very conventional study, it depends from study to study at what type of study I am doing. So what type of variables I have, what type of degree of freedom I have in my experiment. If it is a very conventional methods, like I am evaluating some drug for maybe for anti-diabetic activity. Okay, I'm a very common example. Okay, so we know that every time we uses two dose. One is low dose, one is high dose. Yes or no, Anesha? Yes. So I think so that every time we have a concept that we uses low dose and high dose. Depending on LDPP study, we do like that. So in that case, it is expected and it is accepted by the statistical method also. A minimum n is equal to 6 is acceptable. But recently I got a comments from some of the journals. They told at least 3 dose level is expected. That means one low dose, one medium dose, and one high dose, not 2. If it is like that, so if my designing in like with the 3 dose level, I can take n is equal to 4, because ONU ANOVA or analysis of variance or direct t-test or Kruskal-Wallis test, whatever you told, if the dose level is 3, n is equal to 4 is acceptable. But if the dose level is 2, then I need n is equal to 6 minimum. If it is more, it is better. But minimum you have to take 6. But if the dose level is 3, I can take minimum 4. So that is the standard method. But even again, I am telling, it depends from study to study. What are the variables? What are the degree of freedom in the experiment? What are the variations in individual animals? that are also important, and what are the variations in other factor also is important. And one thing I forget to discuss in the slide that is important, that nowadays the conventional animal method is not that much of important, because everybody is thinking in the worldwide humanized animal models. So what is the meaning of humanized animal model? That means I am implanting a human cancer cell to the mice. Then I am doing the experiment. So that will be more having a more success index. Otherwise, if you take a mice specific cell and doing the experiment in mice, maybe the etiology of that tumor or cancer is not same with the human tumor or cancer. So nowadays, the worldwide there is a trend of doing a humanized animal model. It's very interesting and very scientifically validated nowadays. So humanized animal model. So in that model also, the number is having very important. At what number I will take? What Anush asks is a very important questions and very common to all pharmacologists, that every time we are having a question from the ethics committee that at what number I will take it. But conventionally we take 6 if it is 2 dose, but if it is 4 dose, or sorry, just if it is 3 doses level we have taken, I can take it 3, not 3, I can take it 4 for doing the ono ANOVA test.
One more question we have, that how can we select the 2 doses extract for animal studies? That means the plant extract he is asking.
No, as per the common practices, because you cannot take the doses arbitrarily or randomly. You have to do number of toxicity tests, especially on LD50 test on mice. There is a guideline as per OECD. LD50 studies number 425, 424 and all. So if you got the LD50 value in your hand, so starting dose for that we know that the conventional method what we practice in our lab also, that 1/5 and 1/10. 1/5 and 1/10 of LD50 value will be the starting dose for initial evaluation systems. But you cannot start randomly.
Sir,
Any more questions?
no, sir, there is no questions anymore. So personally, I have one question regarding that you have discussed that if we provide the homogeneous environment to the animals, then we can accept a 90% success rate that is equal to the human studies. But if we not providing or provided the all the environments perfectly to the animals, can we correlate that we can get the 100% result in humans?
No, see. Not only the variations will not come from the case-to-case variations. As I told in the WHO data also, it depends on what method you are collecting blood, how your animal is maintained. It's not like that, because this is one of the important parameters. I am giving a very equivalent environment to each and every case. So the question is why we are using the inbreed strain of animals? Because inbreed strain of animals variation is very less. They are identical. Because at the end of the experiment, I need to compare control versus test, control versus standard. So if all the animals are not same, if they are not identicals, how I will compare? If the animals are not maintained in an equivalent environment, how I will compare? Okay, so whatever you told, that I'm not telling that only by purchasing an IVC the success rate will index or success rate will increase. Not like that, because there are so many factors. This is one of the important factors. Got it?
Yes, sir. Thank you, sir.
So that is one of the important factors, but there are so many factors to consider to increase the success rate, and that's why I told, because all the animal model is having a first questions. Is it the disease model is same with the human model? Is the diabetes I am producing in animal, is it same with human diabetes? No. First question is no. If the breast tumor I am making in animals by giving a carcinogens, is it same with the actual human breast tumor? No. That's why the ultimate success rate is less. So what the proposal is, you have to develop a humanized animal model. That is the worldwide it is going on nowadays. So I am implanting some gene in mice. So that gene is responsible for human particular disease. So that is the model concept of humanized animal models. Or maybe I am implanting a breast cancer cell to a mice. That means I am implanting a human breast cancer cell to a mice. That is the meaning of humanized animal model. By this way also we can increase the success rate. Got it, Sushmita?
Okay. Thank you, sir. Thank you. Okay, I think there is no more questions. Again, so I am requesting the participants, if you have any questions, you can put the questions in chat box. Okay. Okay, sir. I don't think they have any questions. So